In today's video, we're diving into measures of association in epidemiological studies. These are the tools that help researchers figure out whether an exposure truly has a link with a disease. Let's get started. Today's journey takes us from understanding what association means in epidemiology, the study designs used for measurement of association, tools or formula used to measure it and its interpretation, its public health implications, and finally applying these concepts in case scenarios. Let's understand the epidemiological definition of association. In epidemiology, association means a statistical relationship where two variables, an exposure and a disease, occur together more often than would be expected by chance. In other words, if smokers show up with lung cancer much more frequently than non-smokers, that suggests an association worth studying. Next, let's discuss about the epidemiological studies which can be used to measure the association. To measure association, we first look at the types of observational studies available. We choose from three main observational study designs: cross-sectional, case control, and cohort. Cross-sectional studies give us a quick snapshot. Exposure and disease are measured at the same time. They're good for identifying correlations but not strong for cause and effect. Case control studies look backward in time, starting with people who already have the disease and comparing them with those who don't, to see if past exposures differ. Cohort studies move forward in time, following exposed and non-exposed groups to see who develops the disease. These follow groups of exposed and non-exposed individuals over time to see who develops the disease, making them strong for showing cause and effect. Because time frame is built into case control and cohort designs, these studies are especially powerful for figuring out whether an exposure is truly associated with an outcome, so association can be measured. While in cross-sectional studies, exposure and disease are measured at the same time, limited in proving cause and effect since the sequence of events cannot be established. Now that we've understood the study designs, let's move forward and talk about the measures of association used in case control and cohort studies. In case control studies, the key measure of association is the odds ratio, or, which compares the odds of exposure between cases and controls. And in cohort studies, we'll explore several important measures of association. Relative risk, which compares the risk of disease in exposed versus non-exposed groups. Attributable risk, which tells us how much of the disease among the exposed can actually be linked to the exposure. Attributable risk ratio, which expresses that excess risk as a percentage. And population attributable risk, which reflects the overall impact of an exposure on the entire community. Now that we know which measures of association are used in case control and cohort studies, let's dive into the calculation and interpretation. The approach is simple and follows three steps. First, we summarize the data in a 2x2 contingency table. Next, we apply the appropriate formula to calculate the measure of association. And finally, we focus on the interpretation, to understand what the number really means in terms of risk or protection. Now it's time to discuss one of the most important tools in epidemiology, the 2x2 contingency table. This table helps us organize study data by dividing participants into four groups based on exposure status and disease outcome. From here, we can easily calculate measures of association like the odds ratio in case control studies, or relative risk and attributable risk in cohort studies. In short, a 2x2 table is the foundation for turning raw data into meaningful epidemiological insights. Now that we've built our 2x2 contingency table, it's time to discuss the formulas for calculating measures of association. For case control studies, we'll use the formula for the odds ratio, which compares the odds of exposure among cases to the odds of exposure among controls. This is a 2x2 table. The columns separate those with the disease from those without the disease. In the top row we have people who were exposed, and in the bottom row those who were not exposed. So, box A is exposed with disease, B is exposed without disease, C is unexposed with disease, and is unexposed without disease. From this simple setup, we can calculate the odds ratio using the formula, AD divided by BC. For cohort studies, we'll calculate the relative risk, which compares the risk of disease in exposed versus non-exposed groups. From the same table, we can also derive the attributable risk, the attributable risk percent, and the population attributable risk, each giving us deeper insight into how exposure influences disease, both at the individual and population level. Here we have the 2x2 table for a cohort study. From this table, we can calculate several key measures of association. Incidence in the exposed group is simply A over A plus B. Incidence in the non-exposed group is C over C plus D. Relative risk is the ratio of these two incidences, EA divided by IO. Attributable risk, R, is the difference, EA minus IO. Attributable risk percent, R percent or risk ratio, shows the percentage of disease among the exposed that is actually due to the exposure, calculated as R over EA times 100. Finally, population attributable risk, PAR, looks at the overall population by subtracting IO from the total incidence, while PAR percent expresses this as a percentage of the total risk. Before we wrap up, I have a couple of questions for you. Your task is simple. First, identify which type of study design is being used, case control or cohort, and then decide which measure of association applies. The approach is simple: summarize the data in 2x2 table and apply the formula. This will be your homework, and in the next video, we'll go step by step through the calculations and interpretation. Stay tuned.